think you have brought up a lot of fears and concerns and a lot of moments where women come into the knowledge of this. Traditionally, it's not something women are exposed to until they get to a life moment, or unless they're having really heavy cycles early. But fibroids are, I want to lay a little foundation as we talk about it today, if that's okay.
Yes.
Some may know, and but for minorities, especially African American women, uh, we have a huge. They're not the only demographic that is uh, impacted by fibroids, but I want to give a little definition to it as we start our movement to talk about it today. But I really hope that today we can kind of hash out some main concerns women have, and really lay a good foundation so people can get help. That's my goal today, so people can be informed and they move early. Early, that's prevention is better than treatment. So when we talk about fibroids, I really want to make sure that we talk about they're known as uterine fibroids, and when we share about the uterine, we're talking about the base of the uterus there in women, and a fibroid is generally a benign growth, a mass that forms in the tract there, the uterine tract, or there for women, and it tends to develop over time. About studies show that about 20 to 80% of women begin developing fibroids by age 50. With that, the prevalence of fibroids is great, especially here in the U.S. And there's a number of risk factors that go into. So, is it a concern or condition that's directed mainly towards African American women? No, but we are one of the highest groups that are impacted by fibroids, and then we go into specific things that we can talk about, and that's during the reproductive years of African American women, such as yourself, when you began to talk about it. But we do want to say things that can really impact that, and that would be obesity. And so when medically, when they begin to look at obesity, they look at your BMI, your body mass index. So we really want to make sure we take that moment to acknowledge, as we talk about Phatabulous today, and we're getting on with our women of equity, the risk factors for women who are of the plus size nature. The risk factor is higher. And so when we share about these benign growths that come, they're linked to a number of things. So in reference to there's more of a body mass. There's more of a hormonal. They tend to. It's been linked where some studies have shown that there may be a hormonal link to that. So the more mass that you have, the more hormones you produce, i.e., the more risk that you have for especially in the African American or minority setting, to develop fibroids. And so as we talk about those things, that's just a little foundation as we share about the excessive fat on the body, and sometimes the impact of the BMI and how that correlates over to somehow they places one at more of a greater risk, about 2 to 3 times greater, actually, for women who are of the who are designated as obese in
Mhm.
that setting. So we definitely want to take a look at that. Candace, I hope that gives a little bit of a greater foundation as we share about the hormone related concerns that go on with that in uterine fibroids.